to the July 2025 CureJM Town Hall on managing anxiety and promoting well-being for pediatric patients and their caregivers. Before we begin this evening with Dr. Aviya Levy, I want to let you know about a couple of things that are happening in CureJM's life right now. First off, August of 2025, our next CureJM Town Hall is featuring Dr. Megan Curran, Dr. Angela Chun, and Dr. Belina Yee. Our topic will be Starting Strong, a practical guide on essentials for families facing JM, whether you are newly diagnosed or simply needing a fresh perspective. This session is for you. That's coming up on August the 20th. That's a Wednesday evening at 7 p.m. Eastern Time. You'll find in the information below this video a link to be able to register to next month's CureJM Town Hall. Also, a couple of other things you will find on our website as well, and I'll include a link to this below as well. You can see the QR code here to the clinical trials that are currently in process and available to families facing a JM diagnosis. There are currently clinical trials underway and enrolling patients for CAR-T, for CAR-NK, and for anifrolumab, and you can find those at the website listed here or follow the QR code on this slide to find out more. Also, just a quick word of thanks to our sponsors. We are able to do all that we are able to do because of the faithful investment of our corporate sponsors. And now to begin our evening, I'd like to intro Dr. Aviya Levy. Dr. Levy is a pediatric rheumatologist at Rady Children's Hospital in San Diego, California. Dr. Levy brings not only clinical expertise, but also a deep commitment to whole person care. She's the founder of national work groups focused on mental health and narrative medicine in pediatric rheumatology, including for children living with myositis. With training from Brown, Montefiore, Seattle Children's. She got a master's along the way in health services from University of Washington as well while she was working on her MD. Dr. Levy integrates narrative medicine into her rheumatic clinical and research work to help young patients and their families managing the anxiety, depression, and emotional impact of chronic illnesses like the one we are all too familiar with. Will you please welcome Dr. Aviya Levy? Dr. Levy?
What beautiful mime applause. Thank you so much, James, for such a kind introduction and lovely to e-meet all you folks virtually. I know this is not the first thing on your minds that you were hoping to end your Monday nights with, but hopefully we can get through together and you guys can relax a little bit as we talk through some of the topics that we'll talk about today. So before we start, I know James gave you a little bit of my background, but I do want to also share some disclaimers of the topics that we're going to be talking about on anxiety and well-being. The first of which being, while I'm a pediatric rheumatologist, I am not a therapist. I am not a psychologist or a psychiatrist. While I do touch on some of the things that are relevant for those practices, there will be many questions, I imagine, today that I may not be able to answer. And if there is something that comes up that I can't answer, I promise you I will try and, find you the answer for whatever question comes up. The other disclosure that I, want to share is that the work and discussions that we're going to have tonight are a fraction of the work being done in the pediatric rheumatology community in general, in the myositis community specifically. I did want to call out some of the work groups and organizations that are working around mental health for patients with myositis and pediatric rheumatology, patients in general. The first of which is the CARA Mental Health Work Group. CARA, for those of you who don't know, stands for the Childhood Arthritis and Rheumatology Research Alliance that is focused on advancing research to better the care for patients with chronic rheumatologic diseases. And Dr. Knight, Dr. Rubenstein, and Dr. Cunningham have all led some really wonderful work in the mental health space. Just recently, they were able to get approval from the American College of Rheumatology on a white paper around the importance of mental health in pediatric rheumatology, which is a really wonderful advancement. We also have an international organization that I co-lead for myositis specifically, titled the Psychological and Wellbeing Impact Work Group within the MIRA organization. And within that work group, we also recently published a paper that focuses specifically on how mental health affects patients living with myositis, both pediatric and adult patients. So just to give you that context, there is a lot more being done outside of what we're going to be talking about today. Another special thank you that I just want to give a shout out to the folks listed here. For those who are joining tonight, if you haven't heard these presentations from these folks, they have given prior presentations through CureJM that can be found on the CureJM YouTube website. So I encourage you guys to check out the CureJM YouTube links as well for other wonderful talks. So today, as I started off very briefly saying, we are going to hopefully talk about mental health, anxiety, depression, the whole kit and caboodle, and understand the scope of the issue within the myositis community. And then my goal for us is to walk out of today really having some tools and plans of how, together we can try and address some of the issues at hand. Now, the first issue of understanding, where we are in the mental health world is really understanding why is it even important that we talk about mental health? And this is from a study that was done in 2018, where surveys were given both to patients and families and to healthcare professionals to understand what really gives good quality care. What makes that up? How do we give the best care that we can? And you'll see here that one of the agreed upon out of the 19 things listed in the top five was quality of life and the importance of really just having a kid live a good quality of life kind of way where they're not having to see the doctor or, having all the other things that can add that stress. Like, even if you have to do that, how do you really make quality of life better? And there've been some, understandably, some things that are inhibiting that ability to have full quality of life. And, having to deal with the emotional, behavioral, social limitations of living with a diagnosis of myositis, interfering with general family activities, having to live with bodily pain. There's a whole long list of things that are getting in the way of living a full quality life. And when you dig deeper into that quality life, it brings up that question around emotional health and how that plays into, living the full life for what you and your kiddo are really trying to live. And this is based on a survey that was given to patients and caregivers for patients living with juvenile myositis. And it's shocking for some, maybe some in this room have already heard these statistics, but 1 in 3 endorsed depression symptoms. 1 in 2, that's half of the patients and families who responded to the survey, endorsed anxiety symptoms. And 1 in 4 had difficulty adjusting to and coping with illness. Now, these statistics are, lower than what is actually in most of the literature that is out there. And a huge piece of that, based on some of the literature and the work that's been done, is really recognizing how few of these patients actually get in to see a therapist or psychologist or psychiatrist and get that formal diagnosis for depression, for anxiety, and the resources that are needed. And another huge issue is whether it's even discussed in the clinic visit with your pediatric rheumatologist or your regular doctor and whether or not it's being recognized as an issue. So that's one of the things that, hopefully we'll talk about today, of ways to, if you're noticing some of the symptoms that we'll talk about what next steps to take. Now, I talked a little bit about some of the reasons of why stress for patients with juvenile myositis, dealing with the muscle weakness, the rashes, the calcinosis, having to take medications, having their side effects. Many of you know this, from your day-to-day experiences with your kiddos or yourselves, and dealing with, the possibility of a flare, not knowing if tomorrow is going to be the day where your disease is coming back raging and interfering with your school activities. And then, of course, having to see us, the doctors, and the labs that we require, and all the other testing that we do on our side can really cause a lot of stress. And in that paper that I mentioned earlier, we look at a whole host of other things that really contribute to mental health that we may not be thinking about, when we think about why stress. There are those physical and academic limitations where it's interfering with school because you have to see the doctor or you're having, a flare of your disease. There's stigma around mental health, whether people want to talk about it or don't. There's a lot of uncertainty dealing with the diagnosis of juvenile myositis, both uncertainty in the short term of am I going to flare, as well as in the long term of will I go into remission and never have a flare again or not. Unfortunately, it's one of the common things we deal with in medicine in general and pediatric rheumatology in particular. There's also a lot of stress around whether you talk to your friends, whether you talk to your family about what's going on, both for the patient and for you guys. And then one thing that I also want to call out for everyone on the call is how critical it is that caregivers, family members are taking care of their own well-being. Because there is that interplay, both when the kid is stressed, that it can stress out the caregivers and family members, and vice versa, that the kids can really feel some of this other stress going on in the family, and how critical it is that everyone is really getting the support that they need. Now, the other things listed here, there is trauma-related exposure when patients are having to go to the doctor and get medications and get blood draws and do injection medicines, as well as other non-health related trauma that can come up of even just talking about what they're going through. There's concerns around health inequities. There's concerns, and this, we may get some questions later around heritability around mental health concerns that there's been some research about, as well as potential interplay between the disease itself for myositis, where there's inflammation going on in the body, and mental health, where that inflammation in the body is actually chemically changing what's happening in your brain that can increase the chances for anxiety and depression. And then, of course, these other things listed here that we talked already a little bit about why stress. So this is a whole host of reasons, unfortunately, that contribute to some of those statistics that we talked about already for the risk factors for anxiety, depression. This was a survey done for patients living with juvenile myositis to understand, what is impacting their mental health from their own perspectives. And we asked both patients and parents, and you'll see here some of the things that came up were worrying about a flare, stress on the family, changes in appearance, especially for, younger teens or, who are dealing with stretch marks from steroids, for example, or dealing with rashes from myositis, physical limitations compared to the peers, where because of the muscle weakness or, other things that are preventing the kids from getting to do the other things that they want to do in gym or otherwise. Worrying about the future. We talked a lot about uncertainty, limits on outdoor activities, and feeling like they're growing up too fast. A lot of these kids have to learn very early on about taking medications and getting blood draws and seeing the doctor. So all of these are things to keep in mind for what your kiddos are going through too. Now we know, as I mentioned earlier, that big chart, a lot of these interplay and interact with one another, where if you are not able to really be in a good mental state, it's really hard to want to take your medications because you're just like, this is only giving me side effects, or, is it really helping? It can really add stress when you have to think about transitioning to adult care, when you have to think about how it affects your school or affects your work or affects your peer and family relationships. I mean, all of this is really intertwined. And it just highlights the importance of why we need to be addressing this early and often in our clinic visits as well. So as we talk about, we understand the problem. It is a problem. How do we address it and what do we do for you guys and for other families who are dealing with this? We think about it in three prongs. The first is education, just understanding how to identify some of these emotional concerns, and we're going to talk about some of that today. As well as once you understand like what is the problem, how do you identify who is actually dealing with the problem? And then how do you get them the resources, the intervention? How do you provide the care that they may need? So as we talk about, how to improve this emotional health, we're going to talk about this was a survey that was done for social workers, psychologists, from their perspective, what is missing and how do we address the gaps for support for families and patients. And we're going to talk about all of these actually today. The peer support programs is maybe the one that I won't go into as in depth because CureJM is your best peer support program. I know James mentioned earlier the women's support group and all the other support groups that they have, but it is such a wonderful resource to get to connect with other families with such a rare 1 in a million kind of disease. And we'll talk today, really focus on, some of the depression and anxiety interventions and other caregiver coping distress interventions, as well as that, the transition from pediatric to adult care that I know can evoke some stress for folks as well. So first, identifying depression. Now, a lot of these are not going to be surprising symptoms that I'm going to list for you guys. Some of them I'll highlight or present a little bit differently in teens or in younger kids compared to in adults. So for example, in adults, most people think of sadness as the primary presenting symptom, but in teens and younger kids, irritability can actually be the main presenting symptom for patients dealing with depression, where they're just, more upset about whatever comes up. And some people say, well, that's just them being a teen, but sometimes it's really past the level of what they should be, how they should be being irritable. So if you're noticing for your kiddo that they're more irritable, it may be worth looking at some of these other symptoms to see if they have them as well. For example, loss of interest, lack of pleasure, like they're not doing the things that they usually like to do. If they have really low self-esteem or they're feeling more guilty or hopelessness compared to normal. In school, you may notice that they're having more difficulty concentrating, or are having more difficulty making decisions, or having that self-critical thinking where they're thinking they're doing everything wrong. And again, it kind of ties into that low self-esteem. Some of the more visible things that you may notice from the activity and their interactions with the world around them, you may notice they're sleeping more or less than how they normally sleep. They may be eating more or less than how they normally sleep. They may not be eating anything, or they may be eating a lot. Either can present for depression. They may have less energy than usual. They may be more withdrawn. And some patients can have somatic symptoms, meaning they have stomach aches or muscle pains that are actually more a manifestation of their depression coming out. Now, I'm not, as I mentioned, not going to go through all of the different types of therapy and medications that can be used for depression, but one that I did want to highlight that many therapists use nowadays and has a lot of literature to support its approach is cognitive behavioral therapy, or CBT, that some of you may have heard of. It really focuses on the connections between our thoughts, our emotions, and our behaviors and how they all impact one another. And an example of one of the things that is used in CBT therapy is something called thinking traps, where we use a certain rationality to say it's all or nothing. And using the CBT, it helps you realize, well, it's not really all or nothing. There's a gray in between the black and white. Or catastrophizing is another thinking trap where you think everything is the worst thing in the world and really understanding, well, maybe it's not the worst thing in the world. There could be other things, and this is really, on the scale, something that we can cope with. So that's just an example of some of the things that CBT can help address. Now, for anxiety, anxiety actually often presents younger than depression and can start as young as kids 6 to 12 years old. And it is a risk factor for developing depression and developing substance use. And it's something that unfortunately often goes under identified, and patients then often go on to develop these other symptoms. So it is important to try and recognize early so that we can try and prevent them from progressing to some of these other comorbidities. For patients with anxiety, they may experience restlessness or be tense or on edge. They may be easily fatigued and have sleep problems. Often they're thinking about a lot of things before sleep. And just like with depression, they may have somatic symptoms with a stomach upset or muscle aches, or headaches. For the excessive worry is really the hallmark of patients living with anxiety, but they may also have trouble concentrating or irritability, just like we saw with depression. And they may have feelings of nervousness or being scared. Oftentimes, anxiety can be associated with perfectionism of needing everything to be just so. And there may be specific phobias that patients are dealing with as well, that may come out in avoidance, for example, of going to school or avoiding certain social situations. And otherwise, for behavior, again, it depends on the age, but for younger kids, for example, they may be throwing tantrums more frequently, or they may be seeking reassurance more frequently. So those are some of the more typical symptoms to be looking for anxiety. Now, just as with depression, we can use cognitive behavioral therapy as one of the types of intervention, But there are a few other interventions that are commonly used for anxiety. One of the first ones that we think of is exposure therapy, that some of you may have heard of, where you get exposed or face your fear for whatever is causing the fear itself. And you see on the picture here, usually there's this cycle that patients will get where they, instead of facing the fear, they avoid. And it causes, and that avoidance is a positive feedback loop where they then feel better because they avoided it and they didn't have to deal with the anxiety. So then the next time they get exposed, they say, well, I'm just going to avoid it because then I don't have to be afraid. Whereas if you face your fear and you get to the point of realizing, it wasn't as bad as I thought it was, then the next time you're dealing with it, you know already that you can deal with it. So that's kind of the theory behind exposure therapy. And then there's also another option that some like to use of externalizing the anxiety, where you give it a name. And this can work sometimes with the younger kids, of helping them, encourage curiosity and exploration and engagement with the thing that is causing them fear and say, like, well, how can we look at this from a different lens? How can we think of it in a more neutral way rather than thinking of it in that negative context? These are some resources for those interested, for books for their kids or for themselves around anxiety. There's a great New York Times article on mindfulness for children and for us adults in the room. It is great to use Headspace if you haven't tried it before, which is a great mindfulness meditation app as well. And we'll have some more resources as we go along too. Now, I want to acknowledge, as we think about anxiety, one of the very common anxiety producing resources that is often used by family members and caregivers are the information sources that we look at when we are worried about something going on. Often we'll look in Google or we'll look in ChatGPT and try and see what could be going on. And that is a totally normal thing to do. It is also something that can very much encourage that cycle of anxiety. And I would encourage you, if you're noticing yourself that you go towards those resources first, to consider reaching out to your local Cure JM representatives or to your physician if you have a question that's coming up so that we can make sure you're getting the right resources and things that aren't, anxiety provoking, that, are not necessary. So just something to think about too as we think about anxiety for ourselves. Now, the next part of this talk, we'll talk about some general well-being things, and many of these you guys will probably have already have heard of or tried or thought about, and I would be remiss if I didn't at least mention them during a talk on wellness. But I'll give you some other links to things that maybe you haven't seen before. These more common things that you've probably heard of are to make sure you're getting sleep and eating well and doing activity. Some people find it, peaceful to listen to music or make art or journal or write. And some people find it more meaningful to talk to someone about something, whatever you're going through. So all these are really the common go-tos from a well-being standpoint. I want to call out some other helpful things that you may have already tried as well. How to Meditate is a great article from the New York Times as well that has the link there. But other, mindfulness, deep breathing, muscle relaxation are all, and guided imagery, they're all really wonderful outlets for to help you establish a coping mechanism if you do get stressed or something's going on. And then there's a whole long list of other things in the world of the internet that we live in these days, that people have come up with some really soothing online versions of how to make sand art, for example. I have tried several of these, not all of them, but This Is Sand, for example, when I was making this presentation, you glide your mouse on the screen and it slowly drifts sand in beautiful colors as you go across. So that's the bottom picture, my attempt at sand art. They have these other ones that I did not try, but that your kiddos might enjoy or yourselves, like Scream Into the Void, where you quite literally scream at your computer and maybe close your windows so that your neighbors don't hear you screaming. And then there's other ones, for kids that also may be good, like Your Life, Your Voice is a mood tracking emoticon version where it brings mindfulness to what emotion they're having without necessarily having to put words to it, but you can put a picture. So some, kids might identify with that more. And the QR code at the bottom here is a link to all these other ones that are listed in case of interest to you guys. Now, as we think about these, depends on the age of the person that we're talking about for if any of these will be really helpful. So I tried to come up with some age-based advice as well that it may depend on yourself and your family situation. For toddlers, for example, they are not going to be going on the screen in the same way that a teen might be willing to, or that you might want them to. So, some of the things that you can use for toddlers, the breathing techniques, deep pressure massage, muscle relaxation can be really good interventions to help, more from the sensory side of things for toddlers. For school-age kids, I'd recommend trying to come up with a coping toolbox. And you'll see listed on the right here some of the things you can include in a toolbox, for example. And again, it can be age-based depending on where they are in their journey. But having that toolbox at hand, if they're getting stressed, to say, let's take out our coping toolbox. Let's see which of these, feels like a good thing for you to try right now to see if it'll help make you feel like in a better place. And these coping tools can also be used, and I'll transition to the teens. They can also have a coping skills jar for the teens age. Similar concept where they have a list of tools that they can pull out if they're in a stressful situation. Now, for kids early in their diagnosis, this QR code on the right under the RARE journal was put together by a high school student for patients with a new diagnosis for rheumatologic condition to use within the first 40 days. And it has writing prompts in there. It has like other things that are totally unrelated, like hangman, just something to get, the hand moving and give them a place to reflect. So if any of your kiddos are early in their journey, or even later in the journey, it may still be a good resource to look at. And at any stage of the journey, the bottom left QR code is for my Imagine journal that, again, focuses on a more positive skew of what, they may imagine their future to look like or what they're grateful for, thinking about stopping negative thoughts, those kind of things. And as we think about teens transitioning into the adult care, one of the most important things that I will advocate for, especially to try and mitigate anxiety around this, is to prepare early. Both on the like every time you're visiting your doctor, making sure that the kiddo is speaking at the visit or the teen is speaking at the visit so that they feel empowered that, if and when you won't be around in the doctor's visits, that they know that they can talk themselves and say what's going on, as well as them knowing their medications and building up, to the place where they can self-administer medications. Making sure, especially, in the teen years, that they have the phone number to call for the clinic office or, are able to communicate in my chart when something comes up for them that they feel empowered to write, themselves about what's going on. Now, different practices have different limitations around age limits. So it is important if you're, approaching that 18-year-old mark to make sure that you understand from your clinic office. We see patients at my office, for example, until 21. Sometimes it's limited by your insurance. So some insurances will say once you turn 18 or 21 that you have to transition to an adult rheumatologist. So it's worth checking your insurance as well as your provider's practice for that age transition mark. It's also really helpful as you plan early, because I know everyone in the room is going to plan early for this transition process, to try and identify and meet with an adult provider while your kiddo is still seeing a pediatric rheumatologist. It can really help both in making sure that you're comfortable with whoever that adult provider is and making sure that they have all the resources that they need, that you're comfortable before, we send you on to the adult side. It is important when you're thinking about transitioning, if you have multiple specialties that you're seeing, for example, dermatology, to make sure to transition all specialties because it can be really hard for all the specialties to see each other's notes if you only transition one but not the others. So I would encourage you as you're thinking about this transition process in the rheumatology world to think about any other doctors that your kiddo is seeing. And then it's also relevant, thinking about the transition to college or workforce. There are some additional resources that can sometimes be provided. It depends on the practitioner as to whether they can see the kiddo, and when they're coming back from college, for example, or if they need to establish with someone locally just to make sure in case something comes up. So those are all important to address with your primary rheumatologist. Now, for parents, grandparents, caregivers in the room, as we talked about, there is also it's really important to think for yourself as well. If you're dealing with all this, anxiety, depression, anything else that's going on can impact your family member's journey, and impact yourself as you're going through your day to day. Early in the diagnosis and throughout, it's really important to ask questions. Help yourself understand the diagnosis, understand the treatments, because if you don't ask, it may breed unnecessary anxiety when we could answer the questions. And so it's important to ask if there's something that you're wondering about. As we talked about already, it is really helpful to connect with others. I will share that every patient has their own journey. So you may hear from other families something that it does not mean that that is what your family is going to go through. So it is important to go in with that in mind, but it can be really helpful to just connect with others who have some understanding of what you and your family members are going through. Some really find it empowering to advocate, both locally and nationally, around finding more research opportunities for patients with juvenile myositis, or participating yourselves in research to try and help move the needle forward so we know, how we can cure JM as the organization suggests. So those are some things that can also redirect some anxiety and sadness towards more productive avenues. It's also really important to acknowledge that the siblings in the family can also be drastically impacted by what's going on. They may experience survivor's guilt, anxiety, jealousy, insecurity. They may feel extra pressure to achieve if their sibling is having difficulty in school, for example. And most commonly, you'll see the outward negative effects in kids ages 4 to 11, but that does not mean that it is not affecting kids at other ages. It just may mean you're seeing some of those externalized behaviors in the younger siblings. When you're noticing those, I highly encourage to consider things like therapy and, connecting the siblings with other siblings who are going through the same similar processes so they know they're not alone. And it's also really helpful to try and shift the understanding towards a more positive recognition of some of the things that the sibling is gaining. That sometimes, many siblings will, for example, find pride in their siblings' growth and abilities, despite the journey with juvenile myositis. They may gain increased advocacy skills. They may become, want to become doctors because they've been exposed, or nurses, or, because they've been exposed to some opportunities that they wouldn't have been exposed to otherwise. So just trying to remember some of those positive contexts to reframe things for siblings as well. Now we'll end today's talk with some medication-specific tips, because I know that thinking of anxiety and a lot of the things that come up, this is one of the most common areas, especially for younger kids that are starting with methotrexate or IVIG, that can really cause a lot of stress. Methotrexate, as some of your families may have had to deal with, can be given in either injection form or oral form. And one of the most common side effects from methotrexate is nausea. Now, typically, there are two different kinds of nausea that patients can experience. The first that we, from the doctor side, will think about is medication-induced nausea, where the medicine, pathophysiologically causes nausea a day or two after taking the medicine. For that type of nausea, we usually recommend adjustments in the folic acid, where we increase the dose. Sometimes we'll give folinic acid or leucovorin the day after. Sometimes we'll give Zofran or ondansetron as needed. And I recommend, if you're noticing your kiddo is experiencing nausea, to talk with your doctor about any of those options. Some physicians will opt for split dosing methotrexate, where you take, for example, for the version by mouth, you take half the dose in the morning, half the dose in the evening. There's mixed data on that, so it's important to talk with your provider and see, what makes sense for your family. And sometimes patients will experience the methotrexate-induced nausea more commonly with the oral version, and they tend to do better with the injection version. So that's another route that some families will opt to go for. Now, there is also such a thing as anticipatory nausea, where patients have experienced, their body has that reaction to the nausea a day or two after the methotrexate, and it trains the body to say, well, I'm going to get nauseous, so I might as well get nauseous before it happens. And it's an actual medical concern where patients will get nausea the night before they take the methotrexate, or as they're taking the methotrexate, they feel the nausea. Now, typically for that type of nausea, we recommend doing, there are a few different options you can consider. One is like imagery and relaxation techniques to try and breathe through and understand. Sometimes you adjust the timing of when you're giving the methotrexate. For younger kids, they can benefit from like reward boxes associated with methotrexate to get a positive association with the medication instead of associating it with only with the nausea. So those are some ideas for families who've had to deal with anticipatory nausea. And then both with pills and with needles, as many of you may have experienced, there is associated phobias that develop when you have to do injections weekly or taking pills weekly. And if that is something that you and your family are coping with, I would highly recommend talking with your provider. One, seeing if Child Life is available at your site because they typically can go through pill swallowing, graduation techniques. Similar for needle phobia, to think about therapists who also have gradual exposure therapy around needles, where first you talk about the needle, then you put the needle on the opposite side of the room, then you put the needle next to them, then you open the needle so that they see what it is, going through that gradual exposure. I would encourage you to, rather than do it at home on your own, to talk through with someone to make sure you're doing it in a way that is comfortable and safe for your kiddo as well. But those are some things to keep in mind. And then for IVIG infusions, I'm not sure, James, if this is what you were thinking of or other types of infusions that some patients will have to go through. For IVIG infusions, one of the most common side effects that we see are headaches. Oftentimes, that can be addressed. So it is really important if you're noticing for your kiddo that they're having headaches associated with their IVIG. One, make sure that your kiddo is getting hydrated the day before, the day of, the day after, and talk to your doctor because we can actually give extra fluids before giving the infusion, which can help to address some of the headaches that can happen from IVIG. Sometimes we'll also have patients take medications the day before, the day of, the day after the IVIG infusions. So that's something again to talk with your doctor about if your kiddo is having the headaches. And sometimes we'll even do split dosing where we don't give the whole infusion on one day. We split it into one day and then the rest of the medication the next day to try and decrease the headaches. It depends on how progressed it is. I highly recommend. I know I mentioned Child Life once. I will mention it again and again because Child Life is really a game changer, particularly around infusions, where most centers will have some version of a Child Life therapist who is available. They can help provide distraction, art supplies, other kinds of things that can really make the infusion a little less daunting for some kids. They also may go through some other really helpful techniques, including breathing techniques. You'll see here the take five breath. So this is where you count to five with your fingers, and as you're going up, you're inhaling, and then you exhale as you go down from five, four, three, two, one. Another breathing example, if you draw a box called box breathing, if you draw a box with your index finger, when you draw up with the box, you inhale. When you draw across, you hold your breath. When you draw down, you exhale. And then when you draw across, you hold. And you can continue that box breathing until, you feel more zen, and your kiddo feels more zen. Another one that I really love and a lot of my families appreciate is where you have one hand out, like a five-finger hand, and then with the a pointer finger, you trace each finger and you take a breath in as you go up and a breath out as you go down, and in as you go up and out as you go down. And you trace the whole hand, and by the end, everything just feels more relaxed. So that's another one that you can try, particularly, around placing the needle for infusions or before having to take methotrexate. Those can kind of relax the body and are good options to think about. Now, there is a long list of other mental health resources that I didn't go into. I know I mentioned I am not a therapist, psychiatrist, psychologist, but they can offer really great resources for families. And oftentimes, even if there's limitations going in person, telemedicine can be a good alternative option, and defer to them, when they decide around medications. Talking with your local social worker can be super helpful, or school counselor can also offer some extra support in addition to family and friends. We talked about CureJM as a really great resource both for support groups and for attending conferences or walks or events. It's another great resource to really connect with families. I do want to include in here some hotlines. If there are emergencies, it is important to know these, and you can Google also for Suicide Lifeline or text for help. These are important numbers to have just in case. And then James mentioned at the beginning that I have an interest in narrative medicine, so I couldn't not put a slide in here thinking about around mental health. For those who haven't heard of narrative medicine, it's using art and music and writing to process the medical experience. And we've used it within our narrative medicine work group for patients, caregivers, for providers, and it really offers a space to connect with each other in a way that isn't always available. If you're interested in learning more about narrative medicine, joining our work group, or learning more, or have any other questions around that, feel free to email me. The link on the bottom right-hand side is a link to our rheumnarratives.com website, RHEUM narratives.com, that has some additional resources. And with that, I'll open for questions and this wonderful link to emphasize that CureJM, Suzanne Edison, who works with CureJM, has put together an incredible resource for mental health that has all sorts of information for you to find mental health practitioners locally and nationally, other resources. So I highly recommend checking that out as well. And with that, I'll turn it back over to you, James.